Hello there, and welcome to this seminar. I am so glad you're here today. My name is Dr. Christina Yang. I am the lead chiropractor at Relax Chiropractic Wellness here in Westchester, right next to LAX Airport. The reason why we have put this together is for some of you that you probably ended up here because you have some sort of low back pain or sharp pain that's running down into your leg or down to your ankle, to the back of your knee. It might be shooting down sometimes. It can come off as tingling, numbness maybe on the bottom of your feet, or just the calf, kind of weird, like sensitive feeling, and it can be twitching too sometimes. Anything in that sort of like symptoms, it is pointing to sciatica. And you probably have tried physical therapy, chiropractic injections, maybe even considering surgery as your next option. But here's the frustrating part: nothing has actually fixed the problem yet. And so today I'm going to explain exactly why and what kind of options there are that can actually treat the root cause of the issue, and how we have helped thousands of patients in my career of more than 10 years to get rid of the root issues and really have it not come back at all again. Okay, so let's jump right in. Why sciatica actually happens, right? You'll learn why most treatments fail, what actually helps discs and nerves heal. So by the end of this seminar, my goal is to, one, teach you what exactly sciatica is and how it affects your day-to-day life, why most treatments fail, but what helps actually to heal your discs and nerves. So who is this webinar for? It's exactly for you if you have sciatica or nerve pain down the leg. If you've been having chronic issues in your low back pain without the fact that it is sharp and shooting pain. Sometimes sciatica come off as dull, achy, boring pain in your glutes area or even your low back, around your waist. It just comes off in different ways. But essentially, you've been told that you might have like disc bulge, herniation, or degeneration of the joints. You've tried physical therapy, medications, or injections, but you really did not have any success around it. And you want to avoid surgery if at all possible. We all know that surgery is really risky, it's very invasive, and you are put under anesthesia and it comes with a lot of side effects later on in your life as well for that. So, okay. Who is this not for? If you're looking for just quick temporary pain relief and you're like, well, the next day I'll live on with my days and I don't care if it comes back in a day or two, right? If you are that person that only wants medication and you think that it is the solution, because at the end of the day, it really is not. It just is going to mask your symptoms just like a Band-Aid. And if you are that type of people who are not ready to fix the underlying cause, nip the root cause of the issue here, okay? This is actually for the people who want real healing and treat the root cause of the issue. Okay, the sciatica epidemic. I cannot talk enough about this. I see so many sciatica related patients every day. Low back pain. It is the biggest causes today because we all know it. We sit for long hours at the desk. We have poor spinal mechanics. More and more days we're spending more sedentary due to the fact that we now have the modern day work environment and degenerating discs. Obviously aging is part of how we live, right? It just is taking up in our body. It's the previous injuries that you might have were going back way back into childhood, maybe car accidents, maybe you hurt it here and there when you're moving things around, maybe you were pregnant if you were a woman. So yeah, and it might have been the athletic wear and tear too. Those who were athletes and even like competing personal trainers, everyone like that, you would be surprised how many patients I see as highly active individuals. They also go through a lot of sciatica issues. What does sciatica actually mean? What is sciatica? So sciatica is not a muscle problem. It's actually usually caused by a pressure or irritation of the sciatic nerve. So most commonly it is from disc bulge or herniation, degenerative disc disease, which is more like over time your joint disease is getting to be degenerated due to the fact that it's aging, wear and tear happens, and it just kind of gets compressed in between of your bones. You might have spinal compression as well, and that's just the different way of telling you that it is compressed disc that puts the pressure onto the nerve that comes out of the joints either way, and it puts the pressure onto the sciatic nerve that goes into your glutes, down to your leg on the back of your knee, into the side and the back of your calf, down to your ankle. Okay, sometimes it can also affect the peripheral nerves that are on the bottom of your feet. When sciatica can affect, on the bottom of your feet, and it can most certainly skip all your leg, but you do have issues in your compression in your low back, okay, as the root cause. So why does most treatments fail? You probably tried pain medications, epidural injections, and temporary physical therapy, right? But most conventional treatments treat the symptoms and not the cause. If you look at the pain medicine, for example, NSAIDs like Tylenol, or like Motrin, Advil, all these things are just temporary pain relief because at the moment that you're in pain, it's supposed to just relieve your pain for a little bit of time. Epidural injection, same way it works, is it numbs that specific nerve that is getting compressed by the structural issue, and or the joint degeneration, disc bulge, whatever that happens structurally, it's putting that nerve to be compressed, but now they're going in with the injection to numb that specific nerve. But does it really stay numbed for the rest of your life? Not likely. Is this not going to be compressed anymore if you just numb that nerve? Not likely. It's still getting compressed, so you do have that root cause still there. It's just treating the symptoms just to hope that it goes away for a little bit, okay? Temporary physical therapy, again, when it comes to your disc issues that's causing your sciatica, it's not your muscle problem, okay? It's your structure that is getting compressed and getting that nerve to be compressed as a result. So physical therapy works on just strengthening your muscles, may help just temporarily, because a lot of times stretching your structures of your muscles around it may help to reduce a little bit of relief on that compressed nerve temporarily, but it doesn't fix the problem, because it's not essentially muscle issue. The medication traps. So medications can, obviously, like I told you about, it can temporarily reduce pain, but they do not repair disc or decompressed nerve. It does not induce healing at all. It just masks the symptom, okay? But at the same time, the long-term risk, if you're just popping in those pills, it can damage your kidney when it comes to your NSAIDs. A lot of times Advil, Motrins, and everything like that can damage your kidney. If you take Tylenol, it'll go straight to your liver, and you are most likely to have some sort of GI problems, but as a side effect, and you can depend on this medication forever, and that is really a red flag for your wellness and general well-being. So epidural injections. Epidurals are commonly recommended by your health provider if you go to a medical doctor, but they only reduce inflammation temporarily. It does not fix the disc compression. Like I said, it is a structural issue, right? Often it requires repetitive injections, and it takes months after months, and even after you go through the whole course of it, I have so many patients coming back and saying it did not work, okay? So again, it's not a fix. It's a temporary band-aid. Surgery risks. I cannot stress enough how many patients come back after surgery is being done, right? They are still looking for relief and some sort of solution after getting the surgeries in, because that did not fix their problem. They're still stuck with the pain. A lot of times scar tissues form. There's definitely a failed back surgery syndrome, like I told you about. There's so many people that are still stuck in pain after getting the surgeries in. Just in disc damage, the one disc is, supported with the plates and screws in the structure, but the other ones are now getting all the damage due to the fact this is stronger, but the ones above or the below are getting all these wear and tear even more because of the artifact that's introduced to your body that is foreign. And it takes longer recovery time. It takes you to be able to do physical therapy over and over and make sure that you're maintaining your health even after the surgery is being done. So now let's talk about why physical therapy sometimes fails too, okay? Physical therapy can help muscle strength and mobility, like I told you about, but if it is this structure that's compromised, strengthening exercises alone cannot fix it. Again, it's structure problem, not muscle pain problem. You cannot strengthen your way out of a compressed disc. That's, let's be real, it is a different structure of our body that we're talking about that is having this issue and problem. Okay, the real root cause, okay? Most chronic sciatica cases involve degenerative disc disease. So exactly in this picture is showing you what that means. So if the disc loses hydration over time, whether it is due to wear and tear, injuries, genetics, different things, repetitive things that you do, sitting down for long hours, driving a lot, different factors here, maybe you injured it too, then the spine gets compressed, right? And then after that, then if you look at the back side of these discs, the disc comes back towards the back of your spine, where the spinal nerve root at each level comes out, and that compresses this nerve right there because it pops out of that joint space and it now is compressing onto that. It can also be, in the case of degenerative disc disease, that wear and tear of the joints themselves are just kind of like getting rigid lines across the end plates, and they're getting too close to each other, and now they're compressing onto the nerve itself as well. Okay. So the disc generation is extremely common. A lot of us are going through it, either going through it or have had it. So the research shows that by age 40, over 60% of people have disc degeneration. Even if they don't feel pain yet, it's slowly affecting all of us, right? Athletes, office workers, and it doesn't matter how active you are or how long you've been preventing this pain for. It's just this part of how our body is responding to the wear and tear too. The real goal here is that we're not here for pain relief, okay? The goal is to decompress the spine so the root cause of the issue is getting addressed. Restore the disc health so it induces what's called imbibition. It's a process of where the disc goes back into the right places, right, when it gets the stretch that it needs to, and reduce nerve irritation and stabilize the spine so it doesn't come back that way, okay? And that's when the real healing begins. The modern approach at our clinic specifically, we use multi-therapy approach, but all these therapies are not just simple EMS or, the little pad that you probably went to a chiropractor and they stick on and it just kind of gives you pulses. It's completely different advanced therapies that we are introducing you to in our clinic. We only do those therapies that'll give you results, okay? They are top of the tier, newest technology. We have shockwave, which induces the cellular level healing. So it delivers the ultrasonic and electromagnetic field into the damaged tissue cells, and it actually heals at the cellular level. We have class 4 laser that reduces the inflammation very effectively and again induces the cellular healing. We do RF, which is radio frequency, and it's pulsed one that specifically goes to your nerve to regenerate your nerve back, okay? So we have all these multi-therapy approach, and more to add on, we have spinal decompression therapy where we literally strap you on the chest, strap you on the waist, and we have this machine to safely and systemically pull the affected disc. Some of you come in and they go, it's so compressed. I feel like I have to do this stretch and just pull myself up, and I need that stretch to come and reduce the pain. I feel like I have to stretch it out. But every time they go to a chiropractor, they just get them adjusted in 2 minutes, they're out, and maybe if they're lucky, they're getting heat therapy, but it's just temporary pain relief and a little bit of a stem, which is going to help them temporarily. Again, I'm a chiropractor. I have nothing against it, but I just think that it is not problem solving. It's more like temporary pain relief, and hence the reason we used to have it, we got rid of it as soon as we introduced better technology, advanced technology that actually brings the results for patients. So we do use this spinal decompression therapy. Back again, it's on for 25 minutes. It's systemic. It actually pulls you over. Pulse rate, it goes up like a stair-stepping way, slowly introducing that weight and load to give you the most pull, and then it comes back down slowly back to normal again, over the course of 25 minutes per session. But we go up slowly on that low so that your imbibition process of your spine can be rehydrating, going back into the right places. Hence it's not compressing onto the nerve anymore, but that disc is going back into the right places and staying that way. So that really is the root cause approach, and not really just getting rid of the symptoms and symptom relief here. Okay, so we're combining most advanced technologies available. So the technology and therapy, our programs may include advanced therapies, like I told you about spinal decompression, shockwave therapy, nerve stimulation therapies. Again, it's a new stem pod that is introduced, as a new type of therapy, FDA approved, completely safe to use, but it regenerates the nerve cells to be able to get your nerve to function back to normal and not give you that pain again, okay? A lot of times it's very contradictory, where there is a new technology that came out in medicine that burns your nerve out, but without killing the nerve, you want to regenerate the nerve. And if we combine the right therapies together, that's the only way to actually heal yourself, and not, instead, you're not killing any of your structures, you're really healing the right structures and your soft tissues in your body as well. So, and we're going to do targeted chiropractic care as well. We do get you adjusted. We do hands-on therapies, make sure your muscles around it is strong enough to hold the results of our technology and therapies that are being done too. Okay, why combination therapy works better? Obviously, we're targeting it with a multi-prong approach. Think of it as think of the spine as a damaged foundation. You must do different things to be able to hold it. It's just not going to be one thing at a time. It's going to be the multi-level approach. So, one, we're going to decompress the pressure. Two, we're going to stimulate healing. And three, we're going to restore the stability of your spine so it stays that way. Rehabilitation after treatment. So we do introduce you to our app, which on the app itself, you are going to have more personalized chat room, and you can ask questions right away. If you have any videos of yourself doing any of those exercises and you run into any issues and problems or questions, you upload that simply to us and we can review it together. I send back my video of doing it in the right way, and it's more a very interactive tool, so without you having to go to a physical therapy session and drive out and just to do those exercises, all at the convenience of at your home, you can actually see this app whenever you're free and do these exercises and get checked on every time you have any issues and questions. Okay, and obviously we're gonna meet once in a while to administer those therapies that I told you about. So you have chances to go over that with us as well whenever you meet with us in the office. So once the spine is healing, then we want to start you with the gentle functional rehab to stabilize the spine. So we really have really comprehensive approach here. Okay. Rehab you can do at home. Some patients get on our online rehab program like I told you about, okay, without having to spend hours in the clinic. Why our clinic is different? Again, we focus on structural healing. We want to get to the root cause of the issue, and I don't want you to depend on us. I don't want you to be seeing us every day for the rest of your life to get rid of the symptoms and relief. I mean, it'd be nice to come in and chat with us. You're totally welcome to do that. But other than weekly checkup of your spine for generalized wellness for chiropractic, I simply don't want you to depend on us for symptom relief, because deep down I know that you need more than that, okay? And we need an advanced approach to this to be able to heal the root cause of the issue and not just putting on Band-Aid every time you come in. So we combine advanced therapy, technology, chiropractic, structural care, as well as the guided rehabilitation like we told you about as part of the maintenance program. Meet me again. I'm the founder of Relax Chiropractic Wellness. I treat spine conditions for more than a decade. I'm a member of International Chiropractic Pediatric Association. I see chiropractic patients for pediatric and pregnancy. I'm also a Functional Medicine Institute member, so I do functional medicine, and this actually led me to become more root cause healing chiropractor for that reason, because I see that left and right, we're just conventional medicine is just trying to heal, treat the symptoms just to give you some Band-Aid, but oftentimes it just gets worse and it never gets fixed. So I'm recognized, locally for many patients. They love our care. They love our team. Our team is really, really, dedicated in getting you better. We're just like a family. You get better every time, and you see that smile and your complexion just getting better, and it gets light up. And that's what we do. We do very valuable. We really love our patients for that reason, and we would love to see you get better and get to the root cause of the healing, so that way you're set for the better quality of your life for the rest of your life. And I want you to really get the solution you deserve and not just the symptom relief and management. All right, we've been voted as hometown favorite in the local area. We've been trusted by thousands of patients by now, and we really thrive in the community to help more people in community and really just educate them that there is a way to heal at the root cause of the issue, not just target the symptom relief. Patient success stories, there's so many. I do invite you to come onto our Instagram. It's Relax Chiropractic, RELAX Chiropractic spelled out. And there you will see so many patient success stories, and all of them are just like family members to us, but they share how importance of chiropractic care, advanced therapists that went through with us, and how valuable that was in treating the root cause of the issue and getting that solution that they deserve, okay? Again, they tried us after going through physical therapy with no success, pain medication with no success, injections with no success. So we're finally finding the relief through the structural care that you need to do before it gets even worse. So if you have sciatica and you may notice symptoms like pain down the leg, like we told you about, numbness in the foot, weakness when you're walking, pain sitting or standing, changing up positions, sitting down longer than 30 minutes, driving, or putting pressure down, coughing, sneezing sometimes can give you that kind of jerky pain that comes on right away. And you may have trouble getting off the bed in the morning, changing up positions, sitting to standing, standing to sitting, rolling on the bed onto the side when you're changing positions to when you're asleep, and that wakes you up during the sleep if you have pain and things like that. So that all can be signs of nerve compression. And you could have flared it up just recently by lifting something heavy or moving something, or something happened that may have tweaked your low back, but it isn't something that would get better in 3-4 days, because if it was a muscle that you might have pulled, then it would have been better, but it most likely gets flared up like that. And if it doesn't go away within about a week or so, then that's when we start to worry about the root cause being in your disc, and just has been just surfaced up, and it was just one trigger that was just recently added to actually get that sciatica to turn on, since it had been there, slowly getting to the compression onto that nerve in your discs, in your lower back. Okay, so next step is very important. I want you to be evaluated by us. Okay, and we do have a perfect deal for you if you went through this webinar. We're offering a special webinar voucher at $69 only, and this includes consultation, examination. If you have X-ray, MRI, we would love to evaluate it with you, sit you through it, and see what we're looking for when it comes to the sciatica and structural issue. A lot of doctors may have overlooked it and just said, hey, it looks normal, but to us as a chiropractor, we look for the optimal structure, so it may be a little bit of a different approach. So get that second opinion in from us. If you need a prescription, we'll go ahead and file one for you, and you can get it done on the same day. Okay, we'll include, what's even better is we'll include all these therapies that we told you about if you qualify, if your symptoms are gonna get away, but and again, we're gonna treat the root cause of the issue. You're gonna get somewhere even with one therapy with us, because again, this is the most advanced technology out there in the industry. We brought on the most top tier expensive therapies for you, because we want you to see the results and take advantage of it. Come in, get spinal decompression, get shockwave, get laser, get stem pod, get everything that we can do to help you. We truly just want to help you out first and see that this can be a solution for your health, not just for right now, but for the rest of your life too. It may be that some people are losing sleep, losing hours at work, because they just simply can't work anymore due to the pain. And your health shouldn't be your impediment when it comes to career, when it comes to your life and being able to enjoy what you want to do. You can go back to hiking. You can show up for your family when you are not having this issue, right? And so it touches on everything. Your health is everything at the end of the day. If you don't have health, you don't really get to enjoy life the way you want to. So get in, $65 only. It's more than $300 value. There's no practice that offers this much, because we are truly wanting to help you out here, okay? So the bonus is that you will get that free 7-day access if you come in and get your evaluation and treatment with us. Again, I want to give you some value. That way we help you, and then you get to see what we can do to help you better to get to that solution. Okay, and this is online sciatica rehab program, like I told you about. It can be in the form of an app, or it can be a form of a list of things on the online protocol, all guided with videos. Each one of them is very easy to follow. You pick and choose what you want to do for the day, so it isn't like 30 minutes long. You keep track of it on the app right away. It's very easy to use. I think it's very helpful for you as well. Okay, tons of value here for that as well. Now there's limited availability. There's so many of our openings available for you, so definitely take advantage. I will go ahead and give you the link to book yourself online. Again, only $67. If you don't call us and see if we take your insurance, go ahead and do that as well. Call us at 424-800-2488. I'll go ahead and get that in as well in your text message or email, anywhere possible, okay? You can Google Relax Chiropractic and Wellness in Westchester, and you can find us on Google, and there is the booking link as well. So I'm giving you all the resources to take advantage of this. And even with one treatment and therapy, you will get clarity. You will get why you're hurting so much and why you've been struggling this far and not getting any results. 1. 2, you'll actually get the personalized plan for you depending on what causes this issue. And 3, you can finally get rid of this pain and advance in life, whatever success looks like for you, those things that you couldn't do because of the pain. So I think there's tons of value. I think I'm confident that we can help you too. Okay, so go ahead and schedule that. I'll be happy to help. Again, if you want to avoid surgery, you want to get a real game plan, real way to treat the root cause of the issue holistically and not invasive therapies, right? So book your appointment now. Again, you can Google us at Relax Chiropractic Wellness on Google. Book your appointment there, or we'll send it over to you in your text message. Go ahead and book yours, and I will see you in the inside, okay? And hopefully you got some value out of this seminar, learning about what sciatica is and how and why your treatments that you tried so far did not work, but what we have will work for you, okay? Thank you for your time, and see you in the inside. Bye.